Madam President.
Senator from Washington.
Madam President, I just wanted to come to the floor this afternoon to take some time to talk about a law that this chamber passed back in 2009. And I'd like to talk a little bit about what it means to serve in this body and what our responsibilities are and why our constituents sent here in the first place. I have now served here in the Senate for more than 20 years, and I have seen my share of controversial legislation. I've seen Democratic bills that Republicans couldn't stand, and I've seen Republican bills that Democrats would never vote for, and I've seen bills that pretty much everybody opposed. But what I've seen in the last 4 years, since the Affordable Care Act was passed by Congress and signed by the President, is something new altogether. Since the day that law passed, I have seen some of my Republican colleagues set reason and some of their basic duties as public officials completely aside, all in opposition of a law that does mean millions of Americans have access to affordable, quality health insurance that they couldn't get before. It's a law that means millions of young people, many of them fresh out of college, are able to stay on their family's insurance plans. It's a law that says it is illegal for insurance companies to charge you more money just because you're a woman. It's a law that has provided millions of Americans with access to free preventive screenings and health care like colonoscopies and mammograms and flu shots. And it's a law that says if you're an American and you have a pre-existing condition, it is illegal for an insurance company to turn you away. Well, since 2009, I've seen some of my colleagues simply refuse to acknowledge those facts about the law. And I've watched them time and time again not listen to or hear stories of people in their own states whose lives have been changed by the Affordable Care Act, and others who just simply need access to get the benefits that are theirs. Some of my colleagues have even passed laws that make it harder to get covered under the Affordable Care Act. You know, Madam President, one of our responsibilities as senators, as public servants, is to help our constituents access the federal benefits that are available to them, particularly when it comes to health care. That might mean perhaps putting someone in touch of a navigator to help make sure they are getting the most affordable health insurance plan. It may be helping them become aware of an enrollment event in their state where they can learn how to get covered. But our responsibilities don't end there. We also have to have an open, honest discussion about what the Affordable Health Care Act means for our constituents and talk about ways to improve it. Instead, what we've seen is some of our colleagues who spent the better part of 4 years trying to turn this law into a boogeyman and trying to score cheap political points on an issue, Madam President, that can literally mean the difference between life and death. I can understand why some of our colleagues disagree with parts of this law, and I've heard from some people who've had challenges, honestly. And we have to look and say, can we fix this in a way that makes it work better for you? But what I can't understand is why anyone elected to Congress would decide to simply ignore real-life stories of their own constituents whose lives were changed the day this law took effect. I can't understand why anyone would ignore an opportunity to make this law better. Because, Madam President, that's not why we were sent here. We were sent here to listen to our constituents and fight to make sure our laws work for them. So, Madam President, I just wanted to give today some examples from my home state of Washington about people whose lives have been changed by the Affordable Health Care Act, people whose stories have been pretty much ignored here in Washington, D.C. And I know that later this afternoon, several of my colleagues are going to be doing the same thing. So I hope that everybody can turn off the Fox News for a little while and not listen to Rush Limbaugh and really listen to some real stories of real-life Americans who have been impacted by this law. And I encourage them to go home and listen to some of the men and women in their own states, because the stories I'm going to share are not unique. I'll start with the story of Susan Wellman. She lives in Bellingham, Washington. She is self-employed. She's had to pay for individual insurance. Every year, she has watched her health care costs rise higher and higher and higher. It got to the point where she was paying $300 monthly premiums with an $8,000 deductible. all for what she described as paying for nothing. So as soon as she could, Susan got access to health care through our Washington State Exchange and was so happy to have that chance. She spoke on the phone with a real live person, and she was able to sign up for an affordable plan in just a few minutes. Now Susan is on a plan that costs her $125 a month instead of $300. $125 instead of $300. And it has a plan that has a $2,000 deductible, not an $8,000 deductible. And she says it actually pays for things. Guess what? She can now afford to go to a doctor, not just in the case of an emergency, but for a physical or a mammogram that could save her life, not to mention thousands and thousands of dollars in healthcare costs. That kind of preventive care is good for Susan, and it's good for her family. And it's good for this country, because when more people have access to preventive care, it makes healthcare cheaper for every single one of us. Another person I've heard from whose life was changed by the Affordable Health Care Act is a man named Don Davis. He is 59 years old, and he actually goes by Reverend Don. He's a pastor in Seattle, and he's also a volunteer at the Boys and Girls Club. And as the pastor of his church, he doesn't get any health care through his job. He doesn't even have a salary. That meant for a long time that Reverend Don didn't have health insurance. So when he was hospitalized back in 2008 for severe headaches, he was only able to receive an MRI through charity care. Madam President, that MRI showed that Reverend Don had several brain tumors. But when the doctors wanted to do some more testing and provide more care, he didn't have the insurance to pay for that. This is a man who asked for nothing in life, and he woke up every day willing to give to others, but he couldn't get the basic care he needed when he got sick. Now, Reverend Don is healthy today. He's serving his community, and because of the Affordable Care Act, he also has health insurance now. He signed up with a navigator at the local YWCA, and now if he gets a headache, he can afford to go to the doctor. So, Madam President, because of the Affordable Health Care Act, Reverend Don can afford to dedicate his life to people in his community, and he doesn't need to worry that the cost of health care that he needs might be denied him. Finally, Madam President, I want to talk about a couple in Bellingham, Washington, named Rod Burton and Sarah Hill. Rod is one of millions of Americans who have had an utterly maddening experience of being denied insurance because of a pre-existing condition. And in Rod's case, his pre-existing condition was a congenital heart defect. Under our old system, Rod was deemed uninsurable by most insurance plans from the moment he was born. So, Madam President, for a long time, Rod found himself forced into purely catastrophic insurance with a very high premium that wouldn't cover much of anything. That changed for him with the Affordable Care Act. Despite his heart defect, Rod was able to get a plan that covers him and his wife, and they found out they were eligible for tax credits to help pay for it. So today, both Rod and Sarah are covered through a silver plan with lower premiums than the plan that only covered Rod if the worst happened. Madam President, I'm going to yield the floor now. I know we have a number of other colleagues who are here to speak. And I know some of them are here to tell stories from their own states. But I'd like to note today that I only told 3 stories who have people who are benefiting from the Affordable Care Act. These are only 3 people among the 400,000 others in my home state of Washington who have now signed up for care through the exchange, Washington Healthplanfinder. And there are only 3 people among the 4 million people that have signed up across the country. And for the most part, their stories are not unique. Millions of other Americans face the same kind of healthcare problems that they do. It is time that we stop ignoring that reality. It's time that we do our jobs and help our constituents get the health care coverage that they deserve and can now get under this law. Thank you, Madam President, and I yield the floor.